Ladies and gentlemen, I would like to thank Beverly Pierce, one of my subscribers, for this story. Now, they're saying over half of the deaths for COVID 19 are occurring in the Asian American community in San Francisco. And they don't know why so many Asians in the San Francisco Bay are dying from COVID 19. Now, the Asians are blaming it on systematic racism. Now, remember, when it comes down to Black people in America, they tell us that systematic racism don't exist. I wonder if they're going to say that to the Asians. I wonder if they're going to tell the Asians they're playing the race card. Nah, they only reserve that for us. That's only for us. So, ladies and gentlemen, this is USA Today, October 19th, 2020. Mandy Rung was terrified her 12-year-old daughter had COVID 19. It was 2 a.m., and the young girl was hours into a fierce fever and racking cough. She was weak and didn't want to eat. What few medications were on hand had expired, so they had a bunch of expired meds, I guess, in their household. So she sipped on warm water instead. Mommy, why are my eyes on fire? Mm-mm-mm. Mother and daughter, along with Rong's parents, live in an 80 square foot, windowless, single room occupancy in Chinatown building that is home to the last resort for many impoverished Asian immigrants. Impoverished Asian immigrants. Boy, these people really like to perpetrate a fraud. You know, especially when they're dealing with us, everybody's doing better than Black people, but we are seeing all of these communities got their poor. They just hide them. Okay, back to this. Hallways are cramped, bathrooms and kitchens are communal, a ripe setting for the spread of a highly contagious novel coronavirus. That early March night felt endless. Rung 42 repeatedly touched Amy's head, wondering if her child would die in a small loft that the two shared. Down below, her father slept on the floor and her mother took a lone sofa bed. The grandparents were eager for updates on Amy's fever, but they worried their whispers would wake her. In the morning, the fever had vanished, only to return a week later. Once again, the family endured a restless night. Rung made soup, but Amy won't eat it. She cooked porridge and spoon fed her daughter. Getting tested for COVID 19 didn't seem like an option for the Rungs. The rumor was that the tests were expensive. Rung also feared the reaction from neighbors. So apparently, in the Asian American community in San Francisco, if you get COVID, you are demonized. You're demonized. I don't see how that's systematic racism. It seems like that's a problem within their community. How could you demonize a child for getting COVID? Wow. Okay, moving on. Um, if you test positive, everyone would be scared of you, said Ron. Everyone would think you are the devil. Mm. So getting sick is a problem, almost like that Donald Trump stuff. If being sick is a weakness, I guess they got that same thinking. That's weird to me. Very weird. It is easy to mistake San Francisco for a thriving Asian American haven. The city, which it is, own county boasts of a bustling Chinatown, as well as a popular Japantown, Native Hawaiian, Pacific Islanders, Vietnamese, Indians, Filipinos also have made their homes here. All told, Asians in San Francisco represent upward of 20 countries. So they got Asians from 20 different countries living in San Francisco. 20 different countries. But many Asian American immigrants in the county lead a fragile existence rendered even more precarious with the arrival of COVID-19. So far, 38% of 123 COVID-19 deaths reported by the San Francisco Department of Public Health are Asian American. Woo! 38%? Woo! The most of any ethnicity. So Asians get it and die more than anyone else in the San Francisco Bay Area. Experts also are concerned that the positivity rate among Asian Americans in San Francisco could be far higher than 12% reported. So, of course, like anywhere else in this country, their coronavirus in the Asian community is underreported. So nobody should be shocked over that, you know? So I want to show y'all something too that came out in one of the papers there. I found this. Now, we have heard over and over and over that Black people get it disproportionately more than anyone else. I want you to look at this chart that comes out of San Francisco. All right. So, of the cases, just look below. Look at the cases. 273 cases are Asian, 105 Black, 324 white, Latino 914. All right. So this is the case to death ratio. While race had been determined for almost all of the deaths, many of the cases had an unknown race. Therefore, the case to death ratio will be slightly inflated. Okay? So look at the Black number of cases in comparison to all the other races. Just look at that. Okay? And then I want you to look at the deaths. 18 Asian, 4 Black, 9 white, 4 Latino. What do you see, ladies and gentlemen, in this chart? What do you see? See, this is why they like using percentages instead of giving you raw numbers. But when you look at the raw numbers, Black people got it the lowest in the San Francisco Bay Area and have, the lowest amount of death. Latino and Black are neck and neck. But when you look at the cases, we have way fewer cases than the Latinos, white and Asian. Okay. Are you still willing to believe these people when they say you got it disproportionately? This is why I've been saying since they made that accusation, show us the raw numbers. Because when you see the raw numbers, it is not what they're saying. It's not. But see, what's going to happen is somebody's going to come in the comment section and try to twist and turn it and make it seem like, oh, no, wait a minute. Well, this percentage of the population and that percentage, and they're going to try to make you think something that simply is not true. This is why I said from the beginning, when they made the accusation that we get it more than anyone else, show us the raw numbers. Because when you look at the raw numbers, these people are lying. They are lying. Show us the nationwide raw numbers. Show us the nationwide raw numbers, because it can't be true. There are states that have hardly any Black people in it. So there's no way we are sweeping the country with all these cases. And see, it's a big reason why we are, what, not almost going on 10 months of COVID, and they haven't showed us a raw number yet. Always remember that, y'all. And remember what you're looking at in this chart. Raw numbers is what we want. Don't show us per capita. Don't show us percentages. Show us raw numbers. All right. Let me move on. Experts also are concerned that positivity rates among Asian Americans in San Francisco could be far higher than 12% reported, a byproduct of the decades in the making model minority myth, right? Model minority. That's what they referred to them as. Model minority, which characterized this ethnic group as financially successful, physically healthy, and upwardly mobile. And as you can see, they got a very poor population among them, just like anyone else. So they're not all making flows and flows of money, just some of them are. This belief has caused segments of the Asian American community to long be overlooked when it comes to social services for housing, employment, and health. San Francisco is one of the few places in the nation tracking data on Asian American and COVID 19 deaths at the time when officials don't know the ethnicity of the person affected in nearly half of the nation's 7.8 million coronavirus cases. Okay, so if you don't know the ethnicity of all of these people, you're admitting you don't even know the ethnicity, then how do you put out there that Black people got it the most? And you are admitting in this article you don't even know the ethnicity of many of these patients. Y'all, listen, pay attention, pay attention. Wow. Around 17 million Americans are of Asian descent, or 5.6% of the population. In many cases, Asian Americans in this city have received imprecise or no information in their native language about testing, safety tips, housing, and other critical care services during the pandemic. At the same time, the community is struggling with inadequate access to comprehensive health care, the need to keep frontline employment, and growing incidents of anti Asian hate crimes. This model minority thing, that's not us. This is the Asians talking. And this is Judy Young. She's telling you this model minority, we know where that came from. We know where that came from. See, they're willing to prop up anybody in this society over Black people. We know where it came from. Okay? And the Asians are even telling you that ain't us. But we know who bestowed that upon them. She's the executive of the Southeast Asian Development Center, a San Francisco nonprofit that helps area residents from Vietnam, Lagos, and Cambodia. Okay. So she said 80% of her clients have lost their mostly service industry jobs. All right. So I guess a lot of people that come from those parts of Asia over here to the US, they do service type jobs. Okay, so they lost 80% of them have lost their service industry jobs during the pandemic. There is a language barrier, and our community is small, Young said. So the city doesn't think we have any problems when we do. The risk of invisibility is only heightened by the pandemic. Since city health officials do not break down COVID-19 statistics beyond Asian Americans, many advocates for the city's various groups said they are left to speculate about COVID-19 infections and death rates within the individual communities. How many people are dying, and are those people Japanese Americans, Vietnamese, um, Korean, Filipino? No one knows. All right, so if nobody is recording the ethnicity of these people, I'm going to go right back to what I said before. How do you know it's disproportionately black? They're saying a lot of the ethnicities aren't even being reported of the people. All you people lie all the time. Okay, y'all. What is the model minority myth? Xing Tam, mother tested positive for COVID-19 in March. Her symptoms were mild. The medical officials told her to quarantine at home and avoid others. Suddenly, the working class Bayview district, home where Tam, his mother, and 17 other relatives and friends lived together, became uncomfortably crowded. Tam's mother was given one of a 3-story home, 12 rooms. For weeks, everyone in the 2-story house feared they would be next. As his mother recovered, Tam, 39, fretted over the cost of health care. If he got sick, he worried the doctors wouldn't be able to speak to him in the words he could understand. Before the pandemic, life had started to improve for Tam. 5 years ago, San Francisco relatives urged him to leave China and try his luck in the US. He learned some English and landed a job at a hotel and catering. But when COVID-19 hit, his job vanished. The cost of housing in San Francisco is so expensive, his family has no option but to live together. Even if I test positive, I feel there is nothing the government will do to help me more, he said. I can see why people look at Asians here and feel we are well off because we work hard and save whenever we can. But for many of us, it's very challenging. We work hard too. We work hard too. But they go above and beyond to try to downplay any of our hard efforts. That's America for you. For many Asian Americans in San Francisco, the high rate of COVID-19 deaths is directly linked to the corrosive and distortive facts of the model minority myth. Tang Nguyen, a University of California at San Francisco professor of medicine. Nguyen co-authored a report in May by the Asian American Research Center on health that stated they wanted to bring attention to the fact, ladies and gentlemen, that more than 50% of San Francisco COVID-19 deaths at the time were among Asian Americans. Now, ladies and gentlemen, in all of these months that COVID has been going on, don't you find it funny that this is just coming out now? This didn't just start now. They're just talking about it now. Okay? They're just talking about it now. Sorry about that, y'all. Dog was barking and I didn't want all that barking on here. Okay. That's not my dog, that's the neighbor's dog. Okay. So this is what the Asians are saying, y'all. I want you to listen to this. Discrimination also keeping some Asians from getting tested for COVID-19. The website Stop AAPI Hate. So this is a website for Asian American Pacific Islanders have logged more than 2,500 incidents of discrimination across the U.S. since mid March. The attacks have ranged from verbal assaults to acts of physical violence. When Asian Americans hear Donald Trump, who contracted COVID-19 in October, repeatedly call the virus the China virus and Kung Fu flu, it makes them less likely to seek help. A bit like early in the AIDS epidemic, when the gay community was stigmatized, said, all right, so no, that was not really the same. I'm sorry, it wasn't. It was not. It was not. When AIDS came out and this pandemic that's around, they're making a comparison, and I don't think it's quite the same. That's just my opinion, but y'all can tell me what you think. All right, so they're saying the reason why they are being stigmatized is over what Donald Trump is saying. You know, so Chinese citizens began passing through San Francisco, then bridgeless Golden Gate, and they said, many of them appeared there during the gold rush in 1849. And by 1851, some 25,000 Asians were living in that area. By the late 1800s, the Chinese were not just vilified, but outright barred from entering the country, except, there were a few exceptions, of course. White officials charged they were taking jobs from other Americans. Boy, don't that sound familiar? History is always repeating itself. At the height of World War II, Japanese Americans around the country were rounded up and sent to internment camps. Feared as, they put them in internment camps. They get reparations for that. Like, that is the worst thing that ever happened, and we went through 500 years of chattel slavery and still nothing. But being placed in an internment camp is far worse, right? All right. So we know they got reparations for that. So, they go into all of the stereotypes that Asians are facing. And, you know, ladies and gentlemen, they may be going through a few things, but it still don't compare to everything that we have gone through. But it amazes me how much they will write about what has happened to Asians racially in this country since COVID. You know, I mean, but nobody is really writing about us in that kind of way. And never forget how the New York attorney general wanted to give them their own separate hotline for reporting racism, and and just completely going blind to the black people that are there and living through it every day. It's just amazing. But y'all, please tell me what you think about this article. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.